Hello everyone. So today we talk about ABG. ABG means arterial blood gas analysis. That means when the blood is taken from the arteries, not from the vein. So let's see what is ABG exactly all about. So when you take a sample from the arteries or arterial blood sample is taken to obtain certain values, or it can be taken from an indwelling catheter. That procedure is known as arterial blood gas analysis. So mainly this procedure is done for a critically ill patients. So we'll see a list of patients where you can perform this procedure. So these are the indications, like if the patient is critically ill, like patient is having a acute heart failure, kidney failure, any sort of shock, trauma, chronic diabetes, asthma, COPD, hemorrhage, or you can say lung failure. So any kind of very critically ill patient, we can go for ABG, especially the patients who are admitted in the ICUs or emergency. So these are some of the terminologies where we have PaO2, that is partial pressure of dissolved oxygen in the blood, and PaCO2, which stands for partial pressure of dissolved carbon dioxide in the blood. Apart from this, we have bicarbonate ions and pH of the blood. Before doing the ABG, we have certain prerequisites. So that means pre-preparation of the patient that has to be done. That is, record the patient FiO2 value, especially if the patient is on ventilator. Check patient temperature, because if the temperature varies, value of ABG also varies. Explain the procedure to the patient, because according to many researchers, it is a most painful procedure. Heparinize the needle and syringe, because it will help to because otherwise the blood will get coagulate. So always nowadays we have heparinized needle and syringes which are available. Perform Allen's test and wait for at least 20 minutes before drawing the blood for ABG after any changes in the oxygen therapy, or if the patient is on mechanical ventilation. So these are certain prerequisites which has to be done. These are the sites of ABG, that is brachial, radial and femoral. The most easiest to do is for femoral, but the most but recommended side is always brachial. Why we are not recommending femoral? Because the chances of infection is very high at femoral because of the high moisture content, and the patient is also like exposed every time whenever you want to do a ABG sampling. So the most preferred and the recommended site is radial. So it is recommended to perform ABG from radial. Then we have Allen's test. So you can see in this picture like 1, 2, 3, 4. Always check for the Allen's test. The Allen's test it is done mainly to check for the collateral circulation, whether the blood is flowing in both the arteries or not. If the blood is not flowing in one of the artery, please don't go for that artery for the ABG. This is a procedure. First thing, you need to palpate the artery pulsation. Hyperextend your hand. Clean the side with alcohol swab. If it is recommended, you can give local anesthesia also. Insert the needle at 45 degree and take the sample. These are certain conditions which can modify the results of ABG. If there is air bubble, if the temperature is very high, if the heparin is not there, or if you have taken lots of heparin in the syringe. So these are certain things which can change your values. These all are things which we get in a ABG report, that is pH, PO2, PCO2, bicarbonate, sodium, potassium, calcium, chloride, then glucose, lactate and many more. So when you got that ABG interpretation slip, you will get all these values. Let's talk about the normal values. This is the normal pH of blood, that is 7.35 to 7.45. PO2 is about 80 to 100. PCO2 is about 35 to 45. And bicarbonate is about 22 to 26. Let's see what is alkalosis and acidosis. So I told you that pH is 7.35 to 45. If the pH is less than that, it is considered as acidosis, and if the pH is more than 7.45, it is considered as alkalosis. Now we talk about PO2. So PO2 normal, it is 80 to 100 mmHg. If it is less than 80, patient is in hypoxia. But for COPD patient, like if their PO2 is less than 60, that is dangerous. And if it is less than 40, it is life threatening. PaCO2 value normal is 35 to 45. If it is less than 45, it is acidosis. If it is more than that, like it is alkalosis. Let's see about the bicarbonate ions. So bicarbonate ions, it is normal about 22 to 26 milliequivalent per liter. If it is less than 22, it is metabolic acidosis. If it is more than that, it is alkalosis. So always try to remember the units also, like bicarbonate is in milliequivalent per liter. Let's talk about respiratory acidosis. So how to know whether the patient is in respiratory acidosis or alkalosis? Always check for the pH value. When the pH is less, it is acidosis. If it is talk about respiratory, check for the gaseous value, that is PO2, PSCO2. So PCPA CO2 is increased. Here in metabolic acidosis, again it is acidosis, pH is decreasing, CO2 is decreasing, bicarbonate is also decreasing because this is metabolic. If we talk about respiratory, always check for CO2. If you talk about metabolic, check for HCO3. Here it is respiratory alkalosis. So pH alkalosis, pH increases. CO2 because respiratory decreases. Bicarbonate, there are no changes. If it is metabolic alkalosis, so the pH, it is alkalosis, so pH will increase, PCO2 will increase, and bicarbonate, because it is metabolic, bicarbonate will also increases. So always remember, if it is acidosis, the pH will decrease. If it is alkalosis, pH will increase. If it is respiratory, check for the CO2 value. If it is metabolic, check for the bicarbonate value. So this is a chart which tells you about the respiratory acidosis and alkalosis, and metabolic acidosis and metabolic alkalosis. This is a question for you all. A 19-year-old boy brought in emergency with a history of injecting some drug. On examination, respiration shallow, 8 per minute, responded to painful stimulus. So this is the ABG value, that is pH 7.2, PCO2 this much. So this is a clear case of respiratory acidosis. So like this you can solve many of the questions where you can have lots of values, and you can be able to find it out, and you can easily interpret the ABG values. So these are certain do's and don'ts which has to be keep in mind. Like, don't never use any other syringe and needle, avoid taking ABG from femoral, don't puncture the site, and don't transfer the sample without ice pack, otherwise hemolysis will happen. And always local anesthesia should be used. Always do the procedure in a proper manner, explain the procedure to your patient, and be safe. So that's all for this video. Thank you very much, and if you have any doubt and query, you can just put in comment box. Thank you so much.